Today, we shall start with a very important topic in general histology, which is the epithelium. Before moving on to defining and explaining what epithelium is, let's take an overview of the different body tissues. The body tissues are categorized into four basic tissues in the human body. Number one, epithelium. Number two, connective tissue. Number three, muscle. And number four, nervous tissue. Each of these types of body tissues, they have their own characteristic histological features, because of which they have been categorized into their own categories and groups. In our ongoing lectures of histology, inshallah ta'ala, we shall explain and cover these body tissues one by one. So let's start with epithelium. Epithelium for a first year MBBS student is very important from examination point of view. Those universities and medical colleges that have a pattern of exam involving MCQs. Several MCQs are given covering the topic of epithelium. A student must know the definition of epithelium and the different properties or characteristics of epithelium in general. Epithelium is defined as a layer composed of closely opposed cells with little to none extracellular matrix between the cells. The various properties of the epithelium, they have been enumerated and enlisted in this slide in the form of 8 points. Epithelium is avascular, which means that no blood vessels, they are present within the different layers of cells forming an epithelium. So how does the epithelial cells get their nutrition? They get their nutrition from the underlying connective tissue in which the blood vessels are present by the process of diffusion. Epithelium, another property, which is a characteristic hallmark for the epithelium, is the presence of closely opposed cells, not loosely arranged, scattered cells, but rather closely opposed cells forming either a single or multiple layers. These closely opposed cells are attached or joined with each other by the help of various cell junctions present among the different cells. Free surface. What does this mean? The free surface is the uppermost or the apical surface of epithelial cells when they are lying in a layer arranged in a line so that their superior surface reaches either the lumen of the organ which they are lining or the surface of the body, and their inferior surface rests on a basement membrane. When combined in a single layer or multiple layers of the epithelium, these cells, their apical surfaces, they form free surface, because this surface of the epithelial cell is not attached or resting on another structure, unlike the inferior surfaces, which rests on the basement membrane. Polarity is basically, in terms of histology for a cell, is defined as the spatial differences in the shape, structure, and function within a cell. And it covers the different domains of the cell. So A cell usually in an epithelium has four domains, four surfaces: a superior or apical surface, inferior surface, and two lateral surfaces. Another feature of an epithelium is the presence of a basement membrane, which shall be covered in detail its histological features in the next lecture. And last of these 2 points are actually they refer to the function of the epithelium. That is, epithelial cells, they either line or cover the different surfaces of the body, or they form part of the parenchyma of the glands. Parenchyma is the structural functional unit of a gland. So these are the different properties a medical student must know about an epithelium. In your textbooks of histology, a term is mentioned, epithelioid tissue. This tissue, as the name you can see, is referring to epithelioid, meaning epithelium-like. So basically, these type of tissues, they possess some of the properties, not all, but some of the properties of epithelial cells, which we enumerated in the last slide. So you can see that the epithelioid tissues, they are closely opposed cells, just like epithelium, but they lack a free surface. Why they lack a free surface? Because they are present in the form of a cluster or group, rather than arranged in proper layers, either single or multiple. Basement membrane is present in epithelioid tissues, and such type of tissues are found mostly in association with the endocrine glands. So examples in the books which is mentioned in which the epithelioid tissues are present include the lutein cells of the ovary, cells of Leydig in testis, and islets of Langerhans in pancreas. Here, in this diagram on the right side of the slide, you can see this hole is the example. This slide is a microscopic diagram of pancreas. And here you can see an islet of Langerhans, which is considered an example of epithelioid tissue. Moving on to the classification of epithelium. Again, a very important topic when it comes to the viva of histology in exam. It is one of the pet or favorite questions of the invigilators taking viva during professional examination in group of histology. So epithelium is classified as covering and glandular epithelium. Covering epithelium based on their shape and layers is divided into simple epithelium and stratified epithelium. The simple epithelium is further divided according to the shapes of the cells. A simple epithelium is the one, as the name is referring, simple is synonymously used to single. So in this type of epithelium, in simple epithelial tissue, there is one single layer of epithelial cells present, lining the certain organ or surface. And in stratified, multiple layers, more than two or more than two cells of epithelial cells are present. So in simple epithelium, according to cell shapes, classified into squamous, cuboidal, columnar, and pseudostratified. Whereas the stratified epithelium is divided into or classified as stratified squamous, cuboidal, columnar, and transitional. The glandular epithelium we shall cover in detail in the next lecture. Starting with the simple epithelium, as we mentioned earlier, that it is further classified on the basis of the shape of the cells present in the single layer of cells in the simple epithelium. So in squamous type of cells, their width is more than their height, whereas in cuboidal cells, the width and depth and height are almost equal, and columnar are taller cells with height more than the width. This table represents the summarized histological features of the various types of simple epithelium, along with the location in which these types of epitheliums are present. This table is really good in helping students to memorize the basic histological features that they are required to know and understand and memorize for their professional examination. Simple squamous epithelium, its histological features include a peculiar shape, which involves flat fusiform spindle-shaped cell with a central nucleus. So when it comes to drawing, a student is required to draw the simple squamous epithelium by drawing a layer of cells in which the cells have tapering ends, but bulging center with flattened central nucleus. Such type of epithelium can be found in the endothelium lining of the blood vessels, mesothelium, which is a specialized type of epithelium found in the pleural lining and peritoneal and pericardial linings, and alveoli in the lungs. Simple cuboidal epithelium is a single layer of cuboidal cells having spherical central nucleus, and this type of epithelium can be found in the ducts of the exocrine glands, distal convoluted tubules, outer surface of the ovary, and respiratory bronchioles. Simple columnar epithelium is again the type of epithelium comprising of a single layer of columnar cells, top cells. They are characterized by the presence of an oval basal nucleus, and their nuclei can be found roughly at the same level, which is the differentiating feature from its variant epithelium known as pseudostratified epithelium. So again, this point is very important for the students from examination point of view. This type of epithelium is often shown certain cell surface modifications, again a separate topic, inshallah will be covered later on. And these surface modifications include microvilli, gynoecilia. Simple columnar epithelium is found lining the stomach, that is most of the gastrointestinal tract, gallbladder, and the female internal genital organs like uterus. Pseudostratified epithelium. Pseudo means false and stratified the multiple layers. So what exactly does this name of the epithelium imply? It implies that this epithelium is basically simple epithelium, having a single layer of cells. But it gives a false appearance of being multiple layered. Why? Well, number one, the nuclei, they lie at different levels. Why do they lie at different levels? When you will see this pseudostratified epithelium under microscope, you will see that a single layer of cells with variable levels there with their nuclei lying at different levels. Like some of the nuclei will be nearer the apical surface of the cells, while some cells will have their nuclei lying more basally. What is the reason for this? Because the cells, all the cells in a pseudostratified epithelium, they rest on the basement membrane. That is, they reach and lie inferiorly on the basement membrane, but not all cells in the single layer extend to the free surface. So as you can see in this diagram, this is a diagram showing pseudostratified columnar epithelium. And in this diagram, you can see that the nuclei are at different levels. All the cells, they are reaching the underlying basement membrane, but not all the cells are reaching the free surface. What is the reason for that? Some cells, they have variable heights. There are tall cells and short cells, also known as basal cells. And because of their height differences, their nuclei are at different levels. You know that a nucleus is not a very small structure. It needs its own space in a cell. So it tends to lie usually in the wider part of the cell. In this type of epithelium, the tall cells, they have cylinder basal parts. So naturally their nuclei are going to occupy the apical part in a cell. The short basal cells, they rather have broad base and tapering apical surface. So their nuclei will occupy the lower, wider part. As you can see in this diagram, here is a short cell and rest are the tall columnar cells. So you can see where their nuclei are present within the cells. So because of the presence of tall and short cells in a single layer, this epithelium creates an illusion of being stratified epithelium when it is not. Also, another very important point in the histological features of pseudostratified is that it is actually the modification of the simple columnar epithelium. So it also will show cell surface modifications like villi, microvilli, kinocilia, like that. This type of peculiar epithelium can be found in the upper respiratory tract and in the male internal genital organs like the epididymis and ductus deferens. Here we have the two diagrams representing the pseudostratified epithelium, and you can see the ciliated columnar epithelium on the apical surfaces of the cells, and you can see the variable levels of nuclei in a single layer of cells. This is also another example of diagram showing pseudostratified epithelium, ciliated columnar pseudostratified epithelium. Moving on to stratified stratified epithelium, which was also classified according to the number of cell layers present and their shapes. So stratified squamous epithelium, again, very important for a student from examination point of view. For the students that have their pattern including MCQs and SCQs, this type of epithelium is often given to be draw and label in the SCQ portion of the professional examination. Stratified squamous epithelium is present in the places in the body which are prone to wear and tear. They are subjected to pressure and friction. So this type of epithelium provides the covering surface in those locations in the human body. When observed under the light microscope, one can appreciate the different shapes of the cells lining the multiple layers of stratified squamous epithelium, starting from the basal layer. The basal layer in the squamous epithelium can be variable, varying between low columnar to cuboidal. And this is the layer which is mitotically active, meaning it acts as stem cells which give rise to new cells to be added in the topper layers of the stratified squamous epithelium. Next to the basal layer, we have multiple layers of polygonal cells. And on the topmost, we have a squamous layer, could be one or two near the surface. So you can see how variable are the shapes of the cells within a single epithelium, forming multiple layers. So depending on the state of the superficial cells, which is the squamous layer, we can divide the stratified squamous epithelium into keratinized and non-keratinized. So each of these groups within the stratified squamous epithelium, they have their own peculiar and specific histological features. So in keratinized stratified squamous epithelium, the cells, their cytoplasmic space is actually filled 80% with keratin filaments. And they further, with time, they lose their cytoplasm and nucleus. But this is not the case with the non-keratinized. The non-keratinized stratified squamous epithelium cells in this layer, they actually retain their cytoplasm and nuclei. The keratin is also present in this type of epithelium, but it's far more less than that present in the keratinized stratified squamous epithelium. So you cannot say that there is no keratin in the non-keratinized stratified squamous epithelium. Rather, it's less in amount, as seen in comparison to be seen in the stratified squamous epithelium keratinized. Each of these two types of stratified squamous epithelium are found in their own specific locations. So the skin on our body surface belongs to stratified squamous keratinized type of epithelium, whereas non-keratinized is found in the upper GI tract, that is the oral cavity and upper part of esophagus, and in female internal reproductive organs, especially the vagina. These are the two diagrams depicting the two types of stratified squamous epithelium. Here we can see the multiple layers of squamous shaped cells retaining their nucleus. And the basal most is almost low columnar to cuboidal. And then in between, we have some polygonal layers. But you can see that there's hardly any keratin to be found on the uppermost surface of this type of epithelium. On the right side, we have the diagram for the keratinized stratified squamous epithelium. You can see the difference in the two diagrams. The thickest keratin layer present on the topmost part of the stratified squamous epithelium. And here you can see the basal layer of the columnar cells or cuboidal cells with intervening polygonal cells. And the topmost squamous cells, they have lost their cytoplasm and nucleus, so they are filled by the keratin. Up to 80 to 90% of their cell space is occupied by the keratin filaments. Hence, it appears to be like this in the light microscopic examination. Next, we have stratified cuboidal. This type of epithelium has limited or restricted distribution in the body, and it is usually found in the lining of the ducts of exocrine glands and the ducts of sweat glands. Stratified columna has also restricted distribution in the body. This type of epithelium comprises of cuboidal layers on which the columnar layers are present. So the basal layer usually belongs to the cuboidal type of cells, and the topper layers, they usually have columnar cells. This type of epithelium is found in some parts of the mid urethra and conjunctiva of the eye. The next type of epithelium in the category of stratified epithelium is the transitional epithelium. This epithelium, as the name is depicting, transitional. It changes according to the state of the organ. It is also known as urothelium since it is limited to the urinary tract and urinary bladder. So when it comes to examination of the transitional epithelium, if we take the tissue from the urinary bladder, as you all might know, that it is a muscular organ, so it is supposed to contract and relax. In its undistended state, it means it is relaxed. There is no or hardly any urine in the urinary bladder. If you take the tissue from a urinary bladder that is in the relaxed state, you will see under the microscope at least 6 to 8 cell layers, with basal layer starting off as cuboidal and the middle layers comprising of multiple layers of polygonal cells. And when the cells reach the surface, they become more peculiar and more interesting because of their shape. They acquire a dome-shaped surface, apical surface, also called umbrella cells. As you can see in the diagram on the right side, the topmost, here you can see the domes, how the cell surfaces are bulging like a dome. Hence, the name is given to them as umbrella cells. When the urinary bladder is in stressed state, that is, it is filled with the urine, so it is called in a distended state. If you take the tissue then and study it under microscope, you will see 2 to 3 layers, rather 6 to 8 layers. Why this difference? I will explain it now. Basal layers starting off as cuboidal and surface layers becoming more squamous. So what is the reason for undistended state? The cell layers are more to distended state where the cell layers are less. So there is basically a structural feature associated with the transitional epithelial cells that make this change happen. This structure in the transitional epithelium is simply called the plaques or membrane plaques or uroplakins or plaques. So what is this plaque? A membrane plaque is considered to be a region of about 12 nanometer in thickness. These regions are rigid areas located within the cell membrane of these cells. The dome-shaped umbrella cells. It is a feature of the dome-shaped umbrella cells. So these regions are basically in the form of cell membrane enfoldings. So when in the relaxed state, the cells are contracted, and these plaques are found to be located within the cell cytoplasm of the cell surface as fusiform vesicles. When a urinary bladder undergoes the distension, these fusiform vesicles, called plaques, they unfold and re-emerge onto the cell surface, hence increasing the cell surface area as a result of stretching of the tissue. These plaques are anchored to the cytoplasm of their respective cells with the help of microfilaments, which provide structural support during the folding and unfolding process of this type of epithelium according to the state of the urinary bladder. Why the urinary tract is provided with this specialized or special type of epithelium? It's because this type of epithelium provides an impermeable barrier, preventing the urine from passing into the epithelium or beyond it. Again, this type of epithelium is very important for the medical student with regards to their examination. In SAQs, it may come as draw and label, and it may also be asked in the MCQs, especially the mechanism associated with the folding and unfolding of the epithelial layers according to the state of urinary bladder.